I would like to introduce our final award for the evening, the Technology Innovation and Development Award, which recognizes an individual or team who provided key scientific and technical innovation and leadership in a novel product in which biomaterials played an important and enabling role. To introduce our awardee, I invite Dr. Nicholas Pepys up here. I saw him a minute ago. Oh, there he is.
Thank you for staying that late. This has been a glorious afternoon for biomaterials. President Obama delivered the National Medals of Technology and Innovation, and two of our own members, Joe DeSimone and Kato Lorenzen, received them. A really wonderful celebration, a really wonderful, makes us always very proud that we are biomaterial scientists. It makes us very proud that we are biomaterial scientists to recognize another giant of the field, Joe Salamone of Rothschild Industries in San Antonio. Joe started as a chemist. He was born in New York, and he went to undergraduate school at Hofstra University in New York, finished in 1961. And like many young polymer scientists in those days, he went to Polytechnic in Brooklyn, Polytechnic Institute of New York in Brooklyn, where he did polymer science, polymer physical chemistry with Morowitz. And then in 1967, he moved for a postdoc position at the University of Michigan with Charlie Overberger. These are major figures of my generation that I don't think many of the young ones remember, but they were the ones really that started the polymer field. In 1971, he moved to the University of Lowell, what is now known as University of Massachusetts at Lowell. And he went through a beautiful career, which led all the way to his becoming Dean of Engineering at the University of Massachusetts at Lowell. But at the same time, at about the same time, and I remember it because I was a very young postdoc working on a very similar subjects, he started working on ophthalmic biomaterials. What was the problem? The problem was that until those days, because of another famous Clemson Award recipient, Otto Wichterle, we knew how to make soft contact lenses from polyhydroxyethyl methacrylate, and of course we knew how to make hard contact lenses from polymethyl methacrylate. The problem is that polymethyl methacrylate had hypoxia. You couldn't wear a lens of polymethyl methacrylate because it would not allow the oxygen to penetrate. Joe was the first one who sat down and identified the cause for that problem. He knew that silicon had a high permeability to oxygen. So he understood that somehow he had to put silicon inside the lens. But if you put silicon inside the lens, what you're creating now is a hydrophobic material, which obviously cannot be placed on your eye because it doesn't stand and it doesn't feel very comfortable. So he thought of combining the two things together. And don't look at 2016. In 1972-73, people were not thinking black copolymers. They were not even thinking copolymers. They were thinking mixtures. In fact, they were the first ideas for mixtures. And Joe was the first one who said, let's do a black copolymer. And he did a black copolymer of the methacrylate with the siloxanes, and he created a structure where under certain conditions he had those domains of silicon in a milieu that was a glassy material otherwise. So the lens was glassy, but slightly flexible because of the silicon and very highly permeable. And that led to the hard oxygen-permeable contact lenses of the company Boston. He created actually the Polymer Technology Laboratories in the early 70s, and this was an explosion in the field. A few years later, he came with the first wearable lenses that you could wear in the morning and then throw them away in the evening. It changed entirely our field. Suddenly, lenses became like a commodity product. They were not anymore just something that you would wear and you would have to put them in an allergen solution to clean them every night and so on. He revolutionized the field. In the 80s, he got involved with Bausch & Lomb. He became vice president of Bausch & Lomb. He stayed there for 15 years. With them, he started working also on the various solutions for the lenses and so on, and on intraocular contact lenses for treatment of cataract. In 1986, he started the company Rothschild, first in Florida, with his wife, Anne Salamone, who I'm delighted to report she was just elected to the National Academy of Engineering. So both of them are now members of the National Academy of Engineering, one of the very few couples in the United States who are members of both in the Academy. And together they started this company concentrating now on wound healing, on bandages, on systems like that. The results, ladies and gentlemen, has been incredible. And I happen to have here, he has a total of 17 products that are in the market. I'm not talking about products that almost made it but didn't. And some of them have been in the market for many years, like the Pure Vision contact lens, the Soft Lens 59, the Boston Conditioning Solutions and the Boston Cleaners, the Fog Shield XP lens cleaning solutions, and so on. And more recently, all these new systems of bandages and so on. The day I wrote the nomination, which was a few months ago, he had 998 patents, of which 211 were individual single US patents, and the other were international patents. I'm pretty sure he has passed. So we're talking about a giant in the field that we are recognizing today. Unfortunately, Joe, who, by the way, is not only, of course, the Chief Technical Officer of Rochal Industries, but he is an adjunct professor at both the University of Texas in San Antonio, where he lives, and the University of Texas at Austin, in the department that I am. Unfortunately, a few months ago, Joe started passing through some difficult days. Those of you who know it, please send him an email and tell him that you're thinking of him. His email is jcsalamone, with an E at the end, @yahoo.com. So he is not able, we discussed it extensively, whether he should travel today. He is not able to be with us today. But I can assure you he is doing much, much better. And we are all happy and hopeful that in October he will be able to be at the National Academy of Engineering for the induction of his wife, Anne Salamone. He himself is a member of the National Academy of Engineering and National Academy of Inventors, and the Texas Academy of Medicine, Engineering, and Sciences. So the award will be accepted today by one of his close collaborators and a wonderful scientist herself, who will come in a minute to give us a small summary of his work, and that is Kelly Leung, who is a chemical engineer, bachelor's degree from South China University of Technology, and then she went to Utah and got a PhD from the University of Utah in bioengineering. And after that, she was a postdoc at Wake Forest, and then she went to the ranks and she joined Rochal, who is a senior scientist. She's one of those who has really developed some of the products that you may hear to some extent today. Really a wonderful scientist, really driving the field with many patents herself, with many publications. So let's all recognize Joe Salamone, and at the same time, let's ask Kelly to come up to receive the award on his behalf and to give us his presentation.
Thank you very much for the kind introduction for myself and Dr. Salamone. And Dr. Salamone once sent his warmest regards to you, Dr. Peppers, and the SFB. And he very much appreciates being honored with this award. It is my great pleasure and honor to give this presentation on Dr. Salamone's behalf. Technology innovation and development is truly what defines Dr. Salamone. Dr. Salamone has devoted most of his life developing products to improve human health. The products Dr. Salamone and his team developed have been generating over $1 billion of sales every year. And the first steps in product development is to determine the market size and the customer needs. We're only interested in developing products that can generate market sales of over $50 million per year, and we're only interested in developing products that can fulfill the unmet needs of the patients. The next steps is to go through the patent and the scientific literature and to come up with technologies that not only can address the unmet needs, but it can also provide basis for patent protection and therefore build up a barrier against the competitors. And Dr. Salamone and the team currently, as Dr. Pepas mentioned, owns or have over 200 US patents and over 900 foreign patents. And it is also very important to have an experienced team, including experienced multidisciplinary researchers, experienced patent attorneys, as well as experienced manufacturing and commercialization team. We do a lot of research, ranging from the basic research to all the way to clinical research. However, our primary focus is not research, but is to develop and commercialize the product so that it can benefit the patients. I also want to point out that a lot of the people, when they listening to an industrial talk, and they look at the results and they're thinking that that's just a watered down science. This is not true. I met a lot of very talented scientists in industry. They just can't publicize their results because of the IP protection and the confidentiality. All the products that we are working on have to be simple, which is very important for production and also for other reasons such as regulatory, commercialization. All the costs all have to be taken into account. And all the technologies we are working on are creative, novel, and also very importantly, they have to be practical. And we collaborate with numerous universities and companies as well as other institutions. And all these collaborations are very important for the success in our product development. In Dr. Salamone's early career, as Dr. Pepas already mentioned, he and his colleague founded Polymer Technology Corporation, where they first successfully commercialized the gas-permeable contact lens. And this contact lens is known as Boston lens, which truly revolutionized the field of contact lens. And later, this company was purchased by Bausch & Lomb, and Dr. Salamone worked as the vice president of research, where he further expanded the product lines to various types of contact lens, the solutions, as well as eye drops. In the mid-career of Dr. Salamone, in the 1980s, Ms. Anne Salamone and Dr. Joe Salamone founded Rochelle Industries and migrated the technology from eye care to wound care. And combined with Dr. Joe Salamone's background in gas-permeable contact lens and Anne's background in adhesives, Rochelle invented the first non-stinging conformal bandage and coating material. And that this material can be applied, it adheres to the skin, and it prevents the infiltration of bodily fluid, and is breathable. The key components of this invention here is this tris monomer. The siloxane group here is what contributes to the high gas permeability for both the contact lens and the liquid bandage material. Other monomers are included also to strengthen the mechanical properties of the material, as well as to improve the adhesive property of the material. And also importantly, this material can be dissolved in a non-sting volatile solvent known as hexamethyldisiloxane. And this solvent can evaporate within a few seconds, leaving behind a thin layer of transparent conformal polymer. And this is important because all the competitor products use stinging solvent, which is painful upon application. And this technology was later licensed to 3M, which leads to the commercialization of the first Rochelle wound care product, 3M Cavalon. Based on the same technology, more products were later developed for the human and patient and pet care. And the 3M Cavalon products have been used for prevention and the treatment of skin damages caused by bodily fluid. And this product has been used in hospitals and nursing homes worldwide. And 3M Calvin to this date is still the world leader in skin protectant in the marketplace. Rochelle have since moved beyond the original wound care areas. And we are currently working on a variety types of materials or products, including self-compatible substrate, antimicrobial materials, products for diabetic ulcers and pressure ulcers, products for scar reduction, debridement, pain reduction, as well as transdermal drug delivery, all under the guidance of Dr. Joe Salamone as our Chief Science Officer. We're also fortunate enough to collaborate with the scientific leaders in both academia and industry under the support from NIH and NSF SBIR grants, as well as fundings from the Department of Defense. Next, I'd like to talk in brief of two of the Rochelle products that is being under development. And one is based on a cell-compatible substrate, and the other one is based on antimicrobial materials. Okay. So the cell substrate material product is the BioShield, which is a spray-on liquid polymer. And that product is used for improving epidermal regeneration. The cell substrate function of this product is shown here using the MedTech full-thickness skin tissue model in vitro. Fibroblast was cultured in a 3D collagen matrix to mimic the human dermal layer, and keratinocytes was cultured on top of that to mimic the human dermal layer. And to create the wound, the epidermal layer was removed to expose the dermal layer underneath, and the BioShield was applied directly onto the dermal layer. And the length of the newly generated epidermal layer was measured over time and compared to a growth media control. And the results shows that with BioShield treatment, there is a longer distance of the newly generated epidermal layer compared to the control over time. And not only that, the newly generated epidermal layer appears to adhere better to the dermal layer underneath compared to the control, where it tends to lift off from the dermal layer underneath. The BioShield not only can provide a substrate for epidermal regeneration, it can also provide a barrier against infection. And the picture on the left shows a visual example of the barrier function of the BioShield. We added water into a test tube and coated it with a thin layer of BioShield. And on top of that, we added more water dyed in red. And after overnight incubation, or a day or 7 days or whatever, however longer we tested, the net water dyed in red was never able to penetrate through the BioShield layer to reach the water underneath. The image on the right shows the barrier function of BioShield on top of the wound in the pig skin. This is a deep partial thickness burn wound, and the BioShield was added on top of it. And then we added saline solution containing bacteria on top, and the solution just rounds up on top of the BioShield because this is a very hydrophobic polymer, and they're unable to reach the wound underneath. And the barrier function of the BioShield type of material was further tested against a variety types of microorganisms, including gram-positive bacteria, gram-negative bacteria, as well as fungi. And the result shows that none of these microorganisms were able to penetrate through the BioShield to reach the cultural media underneath. And we are currently collaborating with the Southwest Research Institute and the U.S. Army Institute of Surgical Research, working on repair and regenerating damaged facial skin tissue for the wounded soldiers. We're using BioShield technology in conjunction with skin replacement technology developed by our collaborators. And the next area of interest at Rochelle is antimicrobial materials, especially materials for biofilm eradication. Biofilm is commonly found in chronic wounds such as diabetic ulcers, pressure ulcers, venous stasis ulcers, and it not only impedes wound healing, but it can also cause systemic infection and can be life-threatening. And biofilm is notorious for being difficult to remove and being resistant to antibiotics. The antimicrobial materials that are developed at the Rochelle can penetrate through the biofilm and binds to a variety of types of microorganisms and kill them. And also, importantly, they cause minimum toxicity to the skin cells in the wound. And different from antibiotics that are commonly used to treat infection, the Rochelle antimicrobial biomaterials does not cause drug resistance. And different from the silver-based products that are commonly used to prevent infection in the wounds, the antimicrobial products used at the Rochelle does not cause bioaccumulation in the body. Why do we care? Because biofilm poses a serious medical problems. During using the diabetic ulcer as an example, diabetic foot ulcer affects millions of people in the United States. And infection in these wounds causes over 80,000 amputations per year. And the patients with amputation have a life expectancy of less than 5 years. Eliminating biofilm in these wounds not only can improve the quality of life in the patients, but can also reduce the fatality rates. The Rochelle products can also be used for less severe wounds, such as infected adult diaper rash. And here is an example of one of the Rochelle wound care products, antimicrobial wound product, which is the Rochelle antimicrobial wound cleanser. And the results just shows the anti-biofilm efficacy of the Rochelle wound cleanser. 3 different types of biofilms were cultured in vitro. Biofilms made of Pseudomonas aeruginosa, biofilm made of methicillin-resistant Staph aureus, and biofilm made of Candida albicans. These 3 microorganisms were chosen because they're commonly found pathogenic microorganisms in chronic wounds, and they represent gram-negative bacteria, gram-positive bacteria, as well as fungi. The Rochelle wound cleanser was used to treat all these 3 types of biofilm and compared to the 2 commercial controls, saline, which is current standard care for cleaning the wounds, or Prontosan, which is another antimicrobial wound cleanser that have been commercialized by one of our competitors. And the results shows that immediately after the treatment, all 3 products are successful in removing the biofilm. However, after 24 hours without the treatment, there was a strong regrowth of biofilm in the group that was treated with saline, and some regrowth of biofilm in the group that was treated with Prontosan, and the minimum regrowth of the biofilm, all 3 types of biofilm, in the group that was treated by the Rochelle wound cleanser. And we have a lot more data, but unfortunately, we just can't disclose at this moment. Finally, I'd like to introduce the team. Rochelle is a small company that have existed for over 30 years. And Anne is our president and CEO, and Joe is our chief science officer. We're a highly targeted multidisciplinary team with numerous collaborators. And these are some of the collaborators with some of our projects. Thanks very much for listening to my talk, and I really appreciate it.